Dr. A, we have one more short lecture, please, before lunch. So if you'd like to do the introductions.
So here we go. I was getting questions yesterday about the term orbital in the title of the ionic calcium, and people asking if that had to do with eyeballs. So no. So we have Dr. Mamet is here, and also she just came from Singapore and spent about 25 hours flying to get here. So very happy to have her. And she's specifically going to talk about calcium signaling and neurological disorders, and has some really good case information. So we'll bring her right up.
Come on up, and as the doctor is coming up, let's show our appreciation, please.
Thank you so much, Jeremy. Thank you so much, Dr. Anderson, for the introduction. Thank you for having me here. Awesome! Like what Dr. Z said yesterday, it is awesome day, and I'm happy to be here. Okay, so we have something that is very special. It is ionic calcium therapy, and I would like to share with you my experience with it. I want to tell you a little bit of my story. So I started as an emergency physician. And this happened like 13 years ago. And then what happened is that 2 of my children got diagnosed with autism. And I stopped working. I became a full-time caregiver for my children. But the thing is that no therapist that is mainstream seems to work. So I started looking at the other side. And it brought me to so many places around the world to look for an answer for my children. And when I actually got to understand it, I learned a lot from functional practitioners and a lot from naturopathic doctors. And this is a full circle that I am standing here in front of you because I'm just very thankful with everything that I have learned. So in autism spectrum disorder, we have all of us come to know now that there's a lot of factors of inflammation and many of the other things that come together and then create what we have called autism. And the thing is that microglial activation is a very big thing. It's not just in autism, also in a lot of chronic neurological conditions. So immune system dysfunction due to xenobiotic exposure or systemic infection, aberrant NF-kappa beta expression, limited redox capacity, low glutathione level can actually activate the microglia and then cause morphological changes, release of variety of cytokines and proteins, upregulated surface molecules, secreted soluble factors, phagocytosis, and it basically leads to neuronal dysfunction and cell death, and it leads to things like PTSD, behavioral and psychological symptoms of dementia, Alzheimer's disease, ASD, and schizophrenia. So this is actually a very good picture that shows how the activated microglia happened and how the damage leads to inflammation and how actually it leads to a mitochondrial dysfunction. So the mitochondrial activation pathway and inflammatory cytokines, actually is initiated by the binding of the pathogen or damage-associated molecular patterns to intracellular by the binding to the pattern recognition receptors such as NOD-like receptors or toll-like receptor. And this triggers the NLRP3 and caspase-1 into increasing the inflammasome. And this is actually also the oxidative mitochondrial DNA, ROS, it will trigger another production of TNF alpha and IL-6 through the NF kappa B dependent transactions. And this will lead to the cell death through the nitrous oxide activation, and it will lead to mitochondrial degeneration and the increase of glycolysis. And basically what happened, we will actually see the more cell death and more activation of inflammation. So this is another chart of calcium ionic overload in the pathogenesis of Alzheimer. So new research finds that abnormal calcium signaling in Alzheimer's disease neurons can cause Alzheimer's disease pathogenesis. And because of these calcium ion signaling abnormalities, a balance in activities of calcium ion calmodulin dependent kinase 2 and calcium ion dependent phosphatase calcineurin is shifted at the synapse, tilting at the balance between long-term potentiation and long-term depression of synaptic mechanism. As a result, synapses are weakened and eliminated in Alzheimer's disease brains by LTD mechanism, causing memory loss. And this is another picture of calcium ion overload leads to mitochondrial defects. So when calcium ion increases, the ROS production is also increased. There is a loss of mitochondrial membrane potential followed by the release of ROS, causing oxidative stress and apoptogenic drivers in astrocytes. This is a paper that actually, this is a very interesting one because it says that whether if we find that there is dysregulation in neuronal calcium homeostasis in Alzheimer's disease, is it a therapeutic opportunity? Which I think it is. And in autism spectrum disorder, there is an analysis of converging organelle signaling pathways. And we know that there is calcium channel variants that imply risk in ASD. Okay. This is another paper showing calcium signaling and neurodegenerative diseases and neuronal and glial calcium signaling in Alzheimer's disease. So all actually these neurological conditions are very related to neuroinflammation, to calcification, to mitochondrial disorder. So what we are learning is that when there is cell death, there is neuroinflammation, there's going to be increment of calcification in the mitochondria. Okay. And understanding the mechanism of how which the calcium ion signaling contributes to the progression of many of these diseases actually is crucial for the development of effective therapies to combat the devastating neurological condition. This brings us to ionic calcium therapy. What is it? The anti-orbital ionic calcium therapy, again, it is not something to do with the orbit of the eye. It is got to do with the bonding of the calcium. And anti-orbital is just meaning that it is not binding very, very strongly to like what's the normal calcium carbonate is. So when I was actually learning about the pathogenesis of all these, of my kids' condition, of my patient's condition, I learned a lot from Dr. Thomas Levy. He's such a wonderful teacher. And during this time, actually, I gave some talks. And then one of the presentations, I met Dr. Anthony Jimenez. And then he was telling me, pay attention to AIC. And then I did, and when I was in Manila, when I was attending one of the functional medicine conference, I met the people from Pronuvia that introduces me to ISC, and this is something that is wonderful because Dr. Thomas Levy says that all chronic degenerative disease feature increased extracellular and intracellular level of calcium. And the increased intracellular calcium, which always results in increased intracellular oxidative stress. And what happened is that when we are learning this, we understand that calcium supplementation can actually pose and definitely pose a health risk. Because when you are giving a lot of calcium into the body, the calcium actually turns into a deposit of calcium around the body and causing many things. And so we are going to move to a new paradigm where we need to find the way to remove the excess calcium and increase bone intake of calcium, which brings us to anti-orbital organic calcium carbonate. So this is the orbital part of the whole thing. Okay, so I'm also protesting to the Pronuvia when I asked them, why do you call it anti-orbital? It's such a difficult term to tell to my patients. So this is the reason why. Okay, so in the regular calcium carbonate, you have a strong bonding, and there is no net electrical charge. But in the AIC, we are using ionic calcium carbonate that has electrical charge. Why? Because there is weak anti-bonding, which is the term, the anti-bonding, anti-orbital coming from, because we are not, it's not tightly bonded. So how does it get absorbed? This is a very interesting part of it. It actually does not need to go to the small intestine to be absorbed. It will use passive diffusion using the osmotic pressure from the water. The water will be mixed with the AIC to create more space in the stomach to actually have this passive diffusion of calcium, ionic calcium, into the bloodstream. Like what it says is here, that the AIC calcium is absorbed in the stomach, while the regular calcium carbonate actually needs to be binded to vitamin D and afterward get absorbed in the small intestine, and it's going to be like calcium protein binded calcium. So how does it work? By elevating the serum of the ionic calcium, we are going to trigger the pituitary gland to release THS or thyroid stimulating hormone, and the thyroid will release calcitonin, and this will increase the bone turnover, and this will also increase the body-wide decalcification, and this will restore the calcium balance. This is a very good picture of the bone density, and you can see actually there is, in this case, there is a reversal of bone loss with the calcium, the ionic calcium therapy. You can see that there is increment of the bone density in this elderly patient. I have my own story about this. My mother has always had very bad joints, and then she has osteoporosis. And when I put her on ionic calcium therapy, actually what happened is that now her bone density is normal and more better than other normal people. And the thing is that she actually had a remnant of degenerative scoliosis in her spine, which shows that there was really an osteoporosis before her bone density becomes higher. And this is something that I think is very hard to be achieved otherwise. So this is a very good example of how AIC works. So the AIC actually take up calcium from the place that it shouldn't be, and look at this patient. This is a patient that provided by Pronuvia. It's from Korea. It's a patient with calcific tendonitis, and 6 months later, no more. So this is the enlargement of it. I had my personal experience with this as well. I suffered from endometriosis, and actually by using AIC for a year or so, the calcification in my endometrial area is actually reduced to none, and now I actually stop having painful menses. Yeah, so this is another significant improvement that we can see from one patient, that because of the AIC treatment, there is an increase of bone density in the jaw area. This is a patient with fracture, and within the fracture happened in March 2018, and by December 2018, we can see there is bony callus, and there is no evidence of a fracture, and the bone density is normal. So what happens in the brain? So what we want to do is the cellular decalcification and leading to healing pathways using ionic calcium. So using ionic calcium, what we can do is that we can reduce oxidative stress, restore calcium signaling, increase mitochondrial function, reduce cellular inflammation. The indication actually can be used for any case. I use it for almost all of my cases, and this is we can use it for mood or mental disorder, autism spectrum disorder. We can use it for neurodegenerative condition. Okay, so neurons are highly susceptible to changes in intracellular calcium ion concentration. Insufficient intracellular calcium ion content lead to abnormal functioning of neurons, and excessive calcium ion level will cause cell death. So if we can reverse that, it will be wonderful. So excessive calcium ion concentration inside mitochondria produces reactive oxygen-free radicals that damages DNA, RNA, and protein. And the damaged mitochondria upregulate fermentation-based biochemical processes, and the restoration of calcium bioregulation could reverse the damage and normalize metabolism. So what we're seeing is that the increase of neuronal synapses, by establishing the homeostasis of calcium in the body, we can stabilize the cellular calcium. We can also initiate the mitochondrial function. So these are some of my cases. Okay, so I never use AIC as a monotherapy. I combine it with supplements like magnesium, vitamin D. I would also give anti-inflammatory like curcumin, epigallocatechin gallate, and vitamin D binding protein. So this is the first case. This patient is very special. He's a retiree. He was director of a publicly listed company, and he's a very, very go-getter individual, type A personality, 74 years old. The diagnosis that he came by was early dementia. He got multiple allergies. He got eczema. So what happened is that in 1999, he got hernia and then slip disc. And prior to that, he was a runner. He went for marathon. And in 2017, so first what happened is that he got slip disc, and then his knee gave way, and then he started having early symptoms of dementia. So he started to be able to not being able to find his things, and then finally he can't even find his own home. So in June 2019, when he saw me, we started with the ionic calcium treatment, and actually shortly after, about less than a year, he was able to start to remember conversations, name of people, and then he was able to find where he found his things, and then he finally remembered to find his way home. And in May 2020, he sent me a message that he noted a reduction in his weight, and his waistline was reduced by 10 centimeters, and he was able to start using his knees better. In June 2020, he was very excited. He came to me and he said that his scheduled kneecaps operation was canceled. And he could walk for 10 kilometers, and then he was able to, by September 2021, he walks 40 kilometers weekly. So my second patient is a very cute old gentleman. So his son was actually my patient, and then the son brought the father in, and the father has dementia. The father always called the son and tell him that, the son, why are you abandoning me? Why are you leaving me at home? So this patient of mine, he was not able to work. He was not able to do anything because the father kept calling him. And they started the ionic calcium therapy in July 2019. And by December 2019, the frequency of the calls to the son actually reduced. And the son is like, I can finally breathe, you know? And in June 2020, he was able to understand that the son went to work and he could stay at home and he can have his own activities, which is a relief for the whole family. Okay, so this is autism with epilepsy. So this girl, 16-year-old, she came to me actually after a series of treatment all over the world. They went to Germany for stem cell treatment and was given intrathecal stem cell treatment. And what happened is that she got seizure after 4 treatments within the period of 2 years. After that, they choose to come to US to do TDCS for 4 sessions, which actually lead to the increment of the seizures from 1 time a month to 2 times a month. And in July 2019, they started with ionic calcium therapy, and within that period of time to 2022, now the seizure activities has, the days of free seizure expanded to 86 days. It's not totally free of seizure, but this is a remarkable improvement for the child. And she's actually have so much better cognition, awareness. She started to participate in family meetings. Very good result. Okay, so this person, this girl, she's 16 years old. And she was diagnosed with autism at 24 months. She's actually has been my patient for a long period of time, but she only started with AIC at July 2019. So at that time, she was already going to school, but then she got a lot of problems with behavior and sensory integration, and she got bullied as well. And she decided that she was having major breakdowns. She was refusing to go to school, lock herself in the room. This happened for a period of time of 4 months. And then when we started with the calcium, the ionic calcium therapy, within a month, she was able to study again at home. So she stopped locking herself in the room. In November, attention span increased. In January, able to do subjects that she didn't like before. In March, she actually wrote a letter to her favorite YouTuber. In July 2020, start having longer conversation with the teachers. In September 2020, was able to attend a social event, which is Chinese New Year without tantrum. And in Asia, in Singapore, in Southeast Asia, Chinese New Year is a very big thing. And you have like the whole entire room filled with so many people. And then she was able to be there, and I think that's a wonderful thing. And in February, she attended online school, and in March, she went back to school and attended the exam. So this is the girl. It's a beautiful girl. And she was able to take the exam in school, and I think that the mom was so happy. Yeah, and the mom also is my patient. The mom is also taking AIC, and she was able to walk up the stairs and have no more knee pain after 6 months of ASC. Okay, so what's the takeaway points? First, autism or dementia and chronic neurological conditions are associated with neuroinflammation and cellular calcification. Okay, if we are focusing, number 2 is that if you are focusing in bringing down inflammation and attempt to restore the calcium homeostasis, we will see changes in the clinical manifestation of the condition. Okay, so this is my personal story. This is my son 4 years ago. Oh. Can we play the video?
Yeah, we're just going to try it now.
Okay, since we can't play the video,
Okay.
I will later show you my Instagram, where you can find actually the video in my Instagram. So he was very, one of the most difficult patients I've actually ever had is my second son. And when I was seeing other patients, it was like, he was really quite slow in his improvement. But the video that I was about to show is how much he was, how much agitation he used to have, and how calm he is today. Okay, so I'm going to show you my second picture. It's stuck now.
It's stuck. Bear with us.
Okay, so I have 2 children with autism, right? So the first one, so this is my first child. So he was mildly autistic, and he actually one of my greatest helper at home when it comes to helping me with the second brother. He is now, we can consider him neurotypical now. Recently, he expressed his wish that he wanted to study medicine. So this autumn, he is going to England. He's going to study in a boarding school with intention to go to study his medicine in England. So, thank you. Yeah, so that is my story. Okay, so disclaimer, I'm not working for Pronufia, but when Pronufia contacted me and asked me to share my stories and my patients, I was very excited because I think that I can share this, and this is I think this is a Nobel worthy invention, and something that we can't think that could be achieved is actually possible, you know. So please visit their booth. I think you probably know where it is, number 31. And this is my clinic. I have this clinic this is my tagline, live your life without limits. Because what your doctor said, what the mainstream might say, it is not we prove it time and time again that it is possible, you know, we can do the impossible. So this is my Instagram. I use this Instagram to teach many parents on how to connect with their children, what to do at home. So if you want to educate your patients, you probably want to use this to show them that, hey, it's possible. So my last point is actually, one of my teachers, Dr. Sidney Baker, actually said that, have you done your best for this patient? I always advise total acceptance and love for your patients and teaching the caregiver of the patients for the patient. So like for the dementia patient, I teach the son, and for my autistic patients, I teach the parents on how to love their kids. So that's it. I'm very happy to be here, and thank you so much for your kind attention.
Well, thank you, Dr. Mamahit. We appreciate the length of travel and also your contribution to the conference. So thank you so much. And as she said, booth 31, Pronovia, the doctor will be there with